Can you
Yes.
tell us a bit about kidney stones, what they are, how they form, how we can prevent them, and then if we do find that we have kidney stones we can't pass, what we should consider for treatment?
Okay, great. So, when I first was interested in becoming a urologist, we would make foot-long incisions on people to to get a kidney stone out. The technology has advanced so that we can get most kidney stones out with a quarter-inch fiber optic tube. We can use laser energy to break up the stones, and we can take the pieces out with baskets. So most people do not have to get cut on their bodies at all. But women who have had both childbirth and had a kidney stone would pick childbirth every day. So it is one of the most painful things that can ever happen to a person. So we want to prevent them as best we can. Now, even though the technology for getting rid of stones and surgically treating them has greatly advanced, the incidence of kidney stones, or the number of people who have them in the population, has skyrocketed. We're seeing so many more children with kidney stones. We're doing surgeries on children for kidney stones. And most of this is totally preventable because it's based on our bad dietary choices and our lifestyle choices. So, the number one thing for preventing kidney stones is to make sure that you're adequately hydrated. And adequately hydrated. For a simple test, all you have to do is look in the toilet. If you're not taking a drug or a supplement that can make your urine dark, then your urine should look like pale lemonade. If it starts to get dark or psychedelic yellow, then you're very far behind with your hydration. So, what causes a kidney stone to form? Our body gets rid of toxins in multiple ways. We breathe them out, we defecate, we sweat, and we get rid of liquid toxins through our urine. So anything that our body perceives that it doesn't need will show up in our urine if it's a liquid form. And what we have in that urine are crystals. And if we become dehydrated or we have the right environment, the crystals could stick together, almost like those crystal experiments we saw in middle school, where you would put all these things together and then the crystal form would grow. That's exactly what happens in the kidney. So we want to make sure that what is presented to the kidney is either dilute enough through good hydration so that the crystals don't stick together, or that the components of the crystals are decreased. So number one is hydration. Of course, your hydration will vary based on what you're doing. I mean, if you're outside, a big athlete like you are, and you're sweating a lot, you're going to need a whole lot more fluid than a 90-pound elderly woman who's sitting at home all day. So you'll have to calculate your fluid intake based on your activity. And for the average person who's not doing anything extraordinary, it's basically your body weight in pounds divided by 2. So if you weighed 140 pounds, most people would be hydrated if you took 140 divided it by 2, which gives you the number 70. If you stay somewhere in that range with your total fluid intake on a daily basis, you should be hydrated. The second thing that leads to kidney stones is a high salt diet. And this is ubiquitous in the world right now. If you went and had one fast food diet, that would be more sodium than you should have for the entire day. And the problem with sodium is at the kidney level, it's exchanged for calcium. So anytime that you're eating high sodium, you're leaching calcium out of your bones, which can lead to osteopenia or loss of calcium in the bones. And it is delivered to your kidneys, which can lead to kidney stones. So managing the sodium in your diet is very important. For the average person, you should have less than 2,300 milligrams per 24 hours. Sounds like an awful lot, but if you start reading labels and particularly looking at anything that comes in a box or fast food, you'll quickly see that we are having way too much sodium in our diet. One of the old wives' tales out there is that you should limit calcium in your diet. There are actually types of stones that are more likely to occur if you limit your diet too much in calcium. And we need our calcium for bone health. So please do not be limiting the calcium in your diet. Now, if you were a chronic stone former, somebody who's made more than one stone, that would indicate that you would want to have either your urologist or your nephrologist do a panel of blood tests. It's about 30 blood tests and a 24-hour urine. And what the doctor would do is compare what's in your blood to what's in your urine. And then they could make very specific dietary changes. Sometimes medication's necessary, sometimes it's something that you're taking. You had mentioned the vitamin C. So vitamin C is healthy for most people, but if you take too much, it's exchanged at the kidney for oxalate, and oxalates form stones. So if you take too much vitamin C, like this typical scenario we would see in the wintertime, people think if they take a whole bunch of vitamin C, it wards off colds or the flu. And we would see people come in who'd never made a kidney stone before, and they had made one based on taking way too much vitamin C. So if you are making stones regularly, your doctor would check your blood and your urine to figure out exactly what needs to happen. Now, if you've made one or two stones and you just want to try to do what you can best do for yourself, I would encourage you to look at a product called Theralith XR. I have no financial relationship with this company. It's a quality company that the company name is Theralogix, Theralogix. And this product has some natural compounds in it that are actually stone blockers. And so if someone wanted to start themselves on something that definitely wouldn't harm them and could possibly decrease their stone incidence, then that would be a product to try. The other thing we want to be careful about is going on these really high protein diets. I had never made a kidney stone in my life, and I decided that I was going to lose weight going on a very high protein diet. Well, I had my first experience with kidney stones because high protein can lead to dumping of calcium in the urine, which can lead to kidney stones. So we want to make sure that we're taking in the right amount of protein for our exercise level and for our age and for our body weight. So
Cool.
those are the prevention things.